Good afternoon. Thank you for joining us today. From the Legislative Building here in Regina, we have Premier Scott Moe and Dr. Saqib Shahab. As well, joining us on the line is the CEO of the Saskatchewan Health Authority, Scott Livingstone. Premier Moe will have some opening comments and Dr. Shahab will have a short presentation followed by time for questions.
Well, thank you and good afternoon, everyone, and thank you for joining us here today. There continues to be some very encouraging news about the effectiveness of the vaccines from jurisdictions that are further along in their vaccination program than we are here in Canada. For instance, a recent study in Israel showed that out of 163,000 Israelis who received both shots, that's in a population of about 9 million people, about 31 contracted COVID post those shots. That's compared to about 65,000 infections among a similar-sized control group of unvaccinated people. And so that's an effectiveness rate of about 92%, which is very good. So the vaccines are working. We just need to get more people vaccinated, quite a few more here in Saskatchewan, because that's the path for all of us out of this pandemic. That's the way that we are going to get things back to normal. Our healthcare workers have been doing a great job, and I thank them. They've been doing a great job of ensuring that they are getting needles into the arms of people in this province as quickly as possible. But those efforts have pretty much ground to a standstill here today and in recent days, as we have not received any vaccine shipments in over a week now. We expect to receive our next shipment of 5,850 Pfizer doses over the course of the next day or two. And it will be used to do second shots in North Battleford, in Saskatoon, and in Prince Albert, as well as first shots in the community of Moosomin. We are expecting our next shipment of 6,000 Moderna shot doses to come in later this week, previously to be here on February the 1st. That's down slightly as well from the 6,500 doses that we were expecting. Those doses will primarily be used for second shots in the far north and the northwest regions of the province, as well as a few first shots in the west central region, in the communities of Rosetown and Kindersley. The provinces have also been advised that the next shipment of Moderna vaccines, scheduled for the last week of February, will now also be reduced. But we are not aware of what the level of reduction that will be as of yet. So while it's good to say that we are starting to, again, receive some vaccines, they are still very small numbers compared to what we need and compared to what we are able to deliver in this province. As you know, phase one of our immunization plan covers healthcare workers, it covers residents and staff of our long-term care homes, and those other folks that are over 70 years old. That totals about 190,000 people in Saskatchewan. Right now, as we all know, we are working with vaccines that require 2 doses or 2 shots. So we need, for those 190,000 people, about 380,000 vaccine doses just to cover everyone in phase one. So far, we have received under 10% of that amount. This week's shipments will bump that number to about 12% of our phase one target. So we have a long ways to go just to get through phase one. We need more vaccines and we need them more quickly. The federal government says that we can expect vaccine deliveries to really ramp up in the second quarter of this year, and we would like to see that happen sooner, if possible, into Q1. We'd like to see more vaccines approved as well, more vaccine varieties, as well as more which will result in more vaccines being delivered. Our province and our healthcare team is ready. I would note that other countries are speeding up their pace of vaccine deliveries. Just this morning, I noted Pfizer announced it was speeding up its timetable for delivery of 200 million additional doses to the USA. That's from the end of July until May. That's a significant acceleration in the pace of vaccine deliveries. So we'd like to see our federal government negotiate similar increases here in Saskatchewan. Later this week, or early next week, we will be releasing our sequencing plan for when we get out of phase one, into phase two, and into more wide-scale vaccinations in the second quarter of this year. There will be many options for where you can go to get your shot when it is your turn, and I would encourage you to explore these options and encourage you to get your shot. That is our path out of this pandemic. That is our path together out of this pandemic. By getting vaccinated, you know you're not only protecting yourself, you're helping protect those around you. So everyone should get vaccinated when it is your turn to do so. And we'll have more to say about when that time is in the coming days. Finally, I would just make note that today we are confirming the first 2 cases of the UK variant present here in Saskatchewan. I know Dr. Shahab will have more to say about this in a moment. We know this is a more contagious variant, which serves to reinforce to each of us why we need to keep doing what we know works to reduce the spread of this virus, regardless of which variant it is. We need to continue with our physical distancing. We need to continue wearing a mask. We need to continue to stay at home when we are not feeling well and to avoid unnecessary travel. And we need to always follow up with all of the other public health orders and guidelines that keep ourselves safe, keep our families safe, and keep all of those around us safe. We're now 11 months into this COVID conversation and the restrictions and the life as we know it with COVID. And I think we're all ready to make COVID a thing of the past. I just want to say that the impacts of COVID, they're felt by all of us. Whether it be the impacts of the virus itself or the measures that we have put in place to control the spread of the virus. Whether you be a family with an 8-year-old child that is at school off and on and isn't able to play hockey or lacrosse, or at least the games. Whether you be a family with a 15-year-old child that has, in often cases has given up a great degree of their social life that is so important to them. They're not able to see their friends like they normally would. Whether you be a family with a university student like we are, where they have gone to predominantly, if not solely, learning online or learning from home. And they may not have met their other classmates in a new college or a new school or a new community, let alone not met their professors. Whether you be a family that has been unable to gather together or a family that has been unable to visit their loved ones in a long-term care facility, we're aware of the impacts that these measures have had to keep us all safe. They go far beyond the spread of the virus itself. And I want you to know that government is working very hard with Dr. Shahab and other provinces and the federal government to work together to balance these impacts, whether they be directly from the virus or the impacts of the measures. We're working very hard to support the way of life that we all know and we love and we want to get back to, so that we can find our way back to that way of life, find our way back to work, find our way back to our schools on a normal and regular basis, find our way back to seeing our family members, whether they be in a different community or in a long-term care center. We're finding our way back to the hockey arena for our children, to the lacrosse field for our kids, or whether it be finding our way back to a Rough Rider, a Rush, or a Rattler game. But right now, these measures are required. And that's no more evident than today when we have now identified two of the UK variants in Saskatchewan. These are required, and I would say that for our generation, this is our challenge, and this is our time to rise to that challenge. Yes, do we want vaccines sooner? I speak about it every day. Of course we do. Do we want the restrictions in this province removed? Of course we do. Do we want these new variants to arrive, and there's more around the world to be present in our province and in our nation? No, for certain we don't. And it's all the more reason for us to pay attention to the advice that is provided by Dr. Shahab and ensure that we are following the public health advice that is before us. We may have a couple tough months ahead of us as we continue to gain access to the vaccines, which is ultimately our path through this. Until we can get that phase one, through that phase one of our vaccinations, get 190,000 of our most vulnerable Saskatchewan residents, our healthcare workers, vaccinated. The measures that are in place, yes, they are our generation's challenge. This is what we have to do. And we have to do it just a little bit longer. And we most certainly have to do it together. Each and every one of us, all of us, need to pay attention to the public health advice that is before us. We can do this. We can find our way through the next couple of months and to the end of this COVID conversation, all of the measures that are in place. We can do this, and we can do this together. But we do need to do it for the next couple of months. I would just end with thanking the people of this province again for everything that they have done over the course of the last 11 months. And I thank you in advance for what I know you will do over the course of the next few months. We'll find our way through this. The vaccines are coming. We're making them available to each and every one of you as soon as we are able. Thank you for what you've done. Dr. Shahab.
Thank you, Premier. So, first of all, I'll again start by expressing my condolences to those who have passed away this week. 46 deaths since January 26th, with 8 reported today. And we all know that, although our case numbers are trending down, hospitalizations have a lag, 1 to 2 week lag, and deaths also can have a 2 to 3 week lag as well. And with that, I just did want to maybe quickly go through a few slides. I won't show all the slides. The slides deck should be available online, but I did want to just stop at a few key slides. So as you can see, our active cases per 100,000 and our new cases per 100,000 are, still on the high side compared to other provinces, but are trending downwards. We can see a bit of a bimodal peak, but they are trending somewhat downwards. So I think we really need to sustain the course, like the Premier mentioned. If we look at our variants of concern now, any virus can have many variations, but if a variant is seen to behave a bit differently, like more easily transmissible, possibly that's labeled a variant of concern. And and so far there are 3 variants being monitored globally: the UK variant B117, South African variant B1351, and a variant first described in Brazil. 2 variants first described in Brazil, and all are thought to be associated with higher transmissibility, but not more lethal. And obviously, as we move forwards, it's likely we will see many variants, and some may become variants of concern. For testing, the Roy Romanov Provincial Lab has actively been monitoring for variants, just like other public health laboratories, in partnership with the National Microbiology Laboratory in Winnipeg. We have to remember that we have a systematic process for sending samples to Winnipeg. For example, if any case is travel-related, if there's an outbreak, if there's a younger person who's hospitalized in ICU, for example, under 50, in future, if there was a case to develop in someone who's fully vaccinated, all those would be examples where a sample would be tested, and if it's positive, here in Saskatchewan, a sample would be sent for genotyping to National Microbiology Laboratory. Up to 3% of samples were being screened in that way. It may go up to 5 or 6%, and if there's a need, that capacity could be developed in-house as well. So there is a systematic way to send specific samples for further genotyping from Saskatchewan. And then if we look at, this is just from the media, we expect from next week the Public Health Agency to regularly post variants of concern nationally and maybe by province, but certainly from the media, we had said it a couple of weeks back that it's not if we'll see a variant, it's when. So as we can see, many provinces have seen a large number of variants over the last few weeks, Ontario, BC, Alberta, Quebec, and now Saskatchewan as well. So so far our variants are both linked to travel. One person traveled middle of January back from the UK before current restrictions were in place, and after flights had been allowed again, and was quarantining at home. And there's a second close household contact who got exposed. So all cases and contacts are accounted for. So and so at this moment we don't have any evidence of community transmission. But of course, many countries are concerned about community transmission of variants not linked to travel. And as the Premier mentioned, everything we're doing right now is everything that's important to minimize the transmission of any COVID strain, whether it's a variant of concern or the predominant strain right now in Canada. One thing that I do want to emphasize is that, I'll just open it up here as well, is that if you look at our case numbers, we are showing a downward trend. Our cases per 100,000 are at 18.6. Our test positive is 9.1. And it's not uniform throughout the province. Southern rural case numbers are down quite considerably Regina and Saskatoon, moderate case numbers, they go up and down. Even in the north and far north, there are many geographies with low case numbers if you look at the 32 geographies on the dashboard. But then you can have a cluster in one community, and that pulls up the whole indicator for the whole geography in terms of cases over the last 7 days and test positivity. But overall, there is a downward trend. It's not uniform, but it is promising. And this slide just shows that all the indicators, active case rate, new cases, average over the last 7 days, and test positivity, slow downward trend. Not a sharp downward trend, which can happen after lockdown, but with our current measures, there's a slow downward trend. But we do need to stay the course for this to continue at a level where we can look at, possibly changing some of our orders. And this again just shows that, the cases are happening throughout Saskatchewan. We all need to be vigilant throughout Saskatchewan, but obviously the peaks and troughs are variable in different parts of the province. I will not maybe go over all the other slides in the interest of time, but I will stop at maybe our average I will stop at our overall cumulative hospitalizations, ICU admissions, and deaths. Again, this is a reminder that, even with all our measures in place, even though we had low case numbers throughout the spring, summer, and a late but now sustained fall surge that's continuing into the winter, there has been a significant impact in terms of people who were at home. In some cases had mild symptoms, about 40%. About 40% of people who recovered at home but had significant symptoms, and in some cases, some symptoms are persisting. And then, of course, more than 1,000 people who are hospitalized, up to more than 200 who were in ICU, unfortunately, more than 300 deaths. So again, these are all friends, families, people who live in our communities. And so even though we've had significant measures in place and we've done well overall, this is the impact of COVID in terms of hospitalization and deaths. So I'll maybe just stop by saying that, although we were expecting to see variants and we'll continue to monitor closely, while our cases are trending down, I think, like the Premier said, really we need to stay the course. Mask use is extremely important in indoor public places. A mask protects you from others and protects others from yourself. So really, it's a sign of saying that I care about you, and will you please care about me? Physical distancing, repeat studies have shown that 2 meters distance is the way to go, even with variants of concern. Some countries went down to 1 meter, 1.5 meter, but 2 meters or more is the appropriate distance. Reducing close contacts, we're down at median contacts of 3, which is great. Range is about 50. So that's really important. We're keeping our contacts low. Outdoors is better than indoors. Again, the fact that we have variants not just in Saskatchewan now, but many provinces reinforces, and there's now more federal restrictions in place that, we really need to avoid international travel as much as we can. We need to avoid interprovincial travel as well. And if you do have to go and see a close family member, and you're allowed to see them based on the guidelines in that province, it's really important to avoid public places, follow all the public health guidelines wherever you are in Saskatchewan or any other province, because that can reduce the importation of COVID or variants from not just international travel, but interprovincial travel as well. And finally, I think if we sustain this course, our case numbers are trending down, but very slowly. And if we want to continue with our current ability to, do the things that we are able to do, we really all have to follow these measures. We can't guarantee that there will be no transmission with the measures we have in place. Sometimes people are doing everything right and there is transmission. But whenever we see clusters, 9 times out of 10, it's very obvious why transmission happened. And sometimes there's people at work who just get closer to each other at break, which is just normal. Sometimes it's a gathering that shouldn't have happened indoors. Sometimes it's, not paying attention to mask use and in an indoor public place. So I think we do need to keep paying attention to the basics and keep our numbers trending downwards. Thank you.
Thank you, Premier and Dr. Shahab. We will now begin taking questions, and we'll start here in the room. Lynn?
Sure. It seems to, like, where do you think the center of most of these outbreaks are happening? Like some of the doctors seem to have been told that it's a lot of workplaces and then people going home to large families, stuff like that. But that doesn't really seem to line up with Premier, your earlier statements that if everyone follows the rules, like, the cases will go down.
There's a couple of things that, one is that, if we all went into total lockdown, that would actually reduce number of cases. But if you're out and about, we can't totally eliminate transmission, but we can minimize it. And generally, when we see, so where we see transmission, obviously secondary household transmission still accounts from a third to half of all cases. So, and that's sometimes very hard to avoid because, if you become symptomatic, obviously you should isolate at home in a separate room. Other family members should be away from you. Test comes positive. Everyone else has to quarantine for 14 days away from you. I think that's really important. Where that's difficult to do, I think public health and social services does provide support. So that is really important that, secondary transmission, reducing that as much as possible, that accounts for anywhere from a third to half of cases. Second is, congregate living settings, long-term care facilities, personal care homes. Again, we were very fortunate to not have had a lot of outbreaks in the spring last year, in summer. But, what we have seen is that we have now seen up to 35 outbreaks in long-term care facilities, out of which 21 are currently active, 14 have resolved, as well as other congregate living facilities like corrections facilities and other group homes. And so again, we really need to minimize importation of COVID. So very careful around visiting. Staff obviously are doing a lot to make sure that they screen themselves. And now there's regular testing happening for many staff in long-term care facilities. So all those measures, all those layers are attempts to keep COVID out of long-term care facilities. And now, of course, with vaccination, as residents get the first shots and start the second shots, hopefully, that, as evidence from other countries is showing, that will now provide another very important layer of protection for the most vulnerable right now in long-term care facilities, and then 80 and older in the community. But as we move forward, as vaccine supplies come, that'll be another very important layer of protection for those who are most vulnerable. And then workplaces, obviously, those who can work from home should work from home as much as they can. But we've seen that, when you talk about heroes, healthcare workers, but it's many of us who have been working right throughout the pandemic, grocery stores, gas stations, essential work, people who bring our goods by truck or rail. They've been working throughout, and there's good protocols that every workplace has about how to keep yourself safe, not to expose your co-workers or your customers. And customers also have a role to play when you go wear a mask, don't go out shopping if you're unwell. But there also, during breaks, it's just human nature that sometimes people will interact in a way that no one means to, but, you're closer than 2 meters, you're maybe sharing a snack, and that's when transmission does happen. But, so I think all those measures are important, and all those can have an incremental reduction in case numbers.
Follow up?
Yeah. And, like, it's estimated that as many as 35,000 people in the province probably have COVID and just never get tested. And you said, like, test positivity could be around 2% with everyone. Like, and we've seen pretty low testing numbers over the last week. Like, is that really what's driving our low case numbers, or are we actually seeing less people with COVID?
Yeah, so that's a really important point. So we don't just look at one indicator. Obviously, we want anyone with symptoms or concerns to get tested. And we do see that if case numbers go low, like in the south and southwest, testing numbers also start falling below a certain number, and we really want to encourage test numbers. We don't want testing to go so low that mild cases are missed. But then we look at testing rates. We also look at test positivity. If testing rates are low, case numbers are low, test positivity is also low. That's reassuring. If testing rates are low but test positive is high, that means not enough testing is happening. Then, of course, contact tracing capacity, which currently is good, that as soon as you get tested, you isolate, your contacts are followed up, and within 72 hours, your contacts are all followed up, accounted for, and they're also isolating. That breaks the chain of transmission. So these are the things we look at in terms of testing, contact tracing, and then of course, hospitalizations and ICU admissions are also another metric that we can look at very closely. That lags by 2 or 3 weeks, but that, as we can see, our case numbers are trending slowly down. Our kind of hospitalization ICUs are almost level. We also want to see that trending down as well. At this moment, throughout the province, the testing is, we think it's enough, and the contact tracing is keeping up, but we are monitoring that. We would like our test positive rate to come down. So if you have more tests and more proportion of that are negative, your test positive rate comes down. But I think at this moment, testing is not lower than what we would expect, but it needs to be maintained. And this really is a reminder for everyone that there's not a lot of other respiratory viruses going around. So if you have any symptoms that are respiratory in nature or any concern, do get tested, even if the symptoms are mild, because that helps you to isolate, it helps you close contacts, and that breaks the chain of transmission through contact tracing.
We'll
I would just add that our testing in Saskatchewan has been open. Anyone can go get testing, tested whether you're symptomatic or not. And it isn't that way in all provinces. Many provinces are referred to a test, and we have had the capacity to keep that open for anyone to attend or in person to have a test at any point in time here in Saskatchewan. So would we like to see higher testing numbers? I think at times possibly we would, but it is open for anyone to attend.
We'll take another question in the room. Mark?
With a 1 to 2 week turnaround time to confirm a variant, how is that going to limit our ability to effectively contain that variant, especially if it's eventually in the community and transmitting the community?
Yeah, so I'll just maybe, the last column on the right shows daily testing rate per 100,000, and just a couple of jurisdictions where it's dropping below that 125 level. So, but overall testing numbers are good. This is in the reference. Yeah, I think, so that's a really important point. So if you have in-house capacity and that lab is in the same city where the initial test was done, we have to remember that not all samples can be genotyped. So, if a flag goes up, there's international travel or there's other concerns. Even if that capacity is in-house, a normal test result takes between 1 to 3 days, and genotyping will take another 2 days. So even in those situations, you can't rely on waiting for a variant strain to be identified to take all the public health measures. So for example, if you are symptomatic, you should isolate immediately and then go for testing while you're isolating, go in a way that you don't expose anyone else, wear a mask, and obviously let the testing center know that you have symptoms. And then if the test result is positive, immediately contact tracing starts, and then everyone should be isolating. So the measures are the same, even if a few days later the result comes back as this was a variant strain. So the measures are no different, and that's why it's really important for us to not say, oh, this could be just another virus and I won't get tested. That's why it's really important to isolate if you're symptomatic, get tested, and then if there's any concern in your history that you have traveled or there's any other flag that comes up, your specimen will also be tested for variants. But obviously all samples can't be tested, and that's why we have to practice all these measures all the time.
Follow up?
Yes, the NDP is calling on the province to end for-profit health care. Is the government interested in purchasing extended care Saskatchewan properties, and is there a plan to legislate minimum standards of care at these facilities in Saskatchewan?
Well, we have standards of care in the policy within the Saskatchewan Health Authority, and with respect to this government's commitment to long-term care here in the province, I think the people of the province know very well that we have committed vast amounts of resources to ensure that long-term care in Saskatchewan is as safe as it can possibly be, notwithstanding some challenges, admitted challenges that we have had of recent, and we've sent and asked the ombudsman to investigate those challenges specifically to that one facility. Dr. Shahab spoke earlier to the good work that our healthcare staff have done in keeping our long-term care infections, when they occur, confined and contained, and I would also take the opportunity to thank them. But more broadly, over the course of the last over 10 years now, we've invested in I believe we're on our 15th new long-term care facility in the province. We've increased our long-term care staff with a similar amount of beds by about 700, committed to another 300 that are long-term care staff that are in the process of being hired as we speak to ensure that we are able to continue to provide not only the care, but the safe care for our family members in our long-term care facilities here in the province. More work to do. We'll await with specifics on the Ombudsman report with respect to one facility. But most certainly, we're going to continue to invest in not only long-term care, but more directly into our family members that are utilizing long-term care homes and ultimately the people that built our province.
We'll take our next question on the line. Operator?
We have Lara Fominov with 650 CKOM.
Hi, Premier Mo. Earlier this year, when Joe Hargrave resigned after taking a trip to Palm Springs and when Christine Tell went to California, you said you were not aware of any other government members that had traveled out of the country. Were you aware, even though Judy Davis is not per se a government member, she is a prominent member of the Saskatchewan Health Authority Board, were you aware that Judy Davis was in California? And if not, when did you learn of this?
No, I wasn't aware, and I learned of it when it was reported on in the media.
Follow up?
Yes, please. You also mentioned earlier that you don't want people to have the perception that there are rules, certain rules for those in a position of authority, such as government members, and rules for other people as well. Are you concerned about the optics of the SHA board member traveling and remaining in California at this time?
Well, I would first point out that, I would be disappointed that we have a board member that is traveling. She did travel, however, before we had amplified or enhanced the orders in early December, was my understanding. But yeah, disappointed that someone took the opportunity to travel when they're on a board, but also respect the fact that this is a private citizen. This is a private citizen of our province, and it isn't going to be the government that we will provide recommendations, and people are free to make the decisions that they do. However, in government proper, we have asked all of the elected members as well as the political staff that they would not travel. They would follow the government recommendations as they are. We have to also respect the fact that this is a private citizen. We have not extended that ask beyond the political staff and the elected members, as I don't think that collective bargaining agreements would allow for that to be extended out into the public service.
We'll take our next question in the room. Steph?
Mr. Premier, your government's approach to COVID-19 has been pretty much unchanged since about December the 14th. We've seen the deadliest month we've ever seen in this pandemic last month. So why not change your approach when the death rate has gone up, which is the statistic you have said you think about most?
So we may change our approach when February 19th comes around, maybe alter it slightly as we have at other points in time. I would be the first to say that January has been a very challenging month with respect to the fatalities, and we should always remember that each of those fatalities is a friend and family member, and most certainly my condolences are extended to those friends and families of each of those members. That being said, the measures that we have in place are not insignificant. They are significant measures that do prove to lower the numbers of our COVID infections here in the province. They proved that through December, and we have been dropping since, I believe, the first week of January today. Would we like to see them drop quicker? At times, I think it's fair to say that we would, but they do continue on their downward trend, and that is a positive. And if we continue, as I said at the outset in my opening remarks, to all of us follow the public health advice that is here. It is here for our own protection and our own opportunity, and it does work. It's been proven to work.
Follow up?
Respectfully, the health authority have said that the claim that this was working in December wasn't actually just fewer people are just getting tested. So I guess, what are you waiting for? Now that we have a new variant that is in this province, why are you waiting until February 19th to perhaps change or amend whatever word you want to use for it, when you, as the government, have control to bring down these cases quicker than really waiting this long time slowly decrease the overall caseload.
I'll answer the question on the numbers. I'll allow Dr. Shahab actually to speak to what might be different for the UK variant or any other variant as far as our approach as compared to what our approach is today. But with respect to the numbers dropping, as I said, in early December, we had introduced the measures, I believe about December the 12th or 14th. Our 7-day average at that point in time was 288. Today we're at 227. We did go up higher than that post our Christmas bump. The numbers did decrease throughout December into the Christmas season, and then we did have that bump throughout January. So the measures that we have in place have in a large part kept Saskatchewan residents safe. We've seen, yes, more fatalities, and most certainly we'd like to see in Saskatchewan. And in fairness, I think we've seen active cases across Canada over the course of the last few months be higher than what we would like to see them, and fatalities be higher than what we would like to see them. One fatality is by far too much. So the measures that we do have in place are working. They continue to work. We can talk about whether they should be faster or slower, but they are in place. They are working. They do work better when each and every one of us commits to following that advice that is there. But Dr. Shahab, do you want to speak specifically to the different variants and if there's anything that would be changed in our approach as to how to manage the spread of those?
Yeah, so in terms of, the measures, obviously we look at what are the settings where transmission is happening that we are aware of, and then what measures can we continue, what can we tighten, what can we relax. And so, I think a fundamental measure that's in place is that really you can't, unless you are living on your own, you really can't meet anyone else outside of your household, and you can just meet and greet each other from a safe distance outdoors. I think that's a significant measure, and that was in place because transmission indoors within households at social gatherings was a significant driver. Obviously, we still have the ability to go to a restaurant or bar. And again, a restaurant or bar is not zero risk, it's moderate risk with the current transmission rates. And if people are willing to take that risk and sit at a table of 4 and follow all the guidelines, there may be transmission or there may not be, but it's a moderate risk. But obviously, when those measures are not followed, you can have an outbreak in a household if people are gathering when they shouldn't be, which we've seen, unfortunately. Or you can have an outbreak in a public place like a bar or restaurant where people aren't following the guidelines. So I think it is important that whatever the measures are in place, we all have to follow them, because if we don't, we put ourselves at risk, but we also put the business owner at risk and other customers at risk, whether it's a retail location, bar, restaurant, not going shopping if you are unwell. We've also seen throughout last year that if you are, if you follow all the guidelines, we can keep our case numbers low while essential work needs to happen, whether it's manufacturing, retail, those kind of sectors. But when transmission rates are high, the risk that you may run into someone who is infectious, asymptomatic, and sharing COVID is higher, that 2%. And that's why we have to be extra diligent, mask use all the time. We have people who come into our houses to provide an essential service like repair a furnace. They are all wearing masks. If we are not, as a household member, wearing a mask, we are exposing them. They may go into dozens of houses a day. We need to do our part to protect people who may have to come into a house to provide an essential service, to people who may be working in retail, because they have a mask on to protect you. But if we don't have a mask, we are not doing our job to protect them. So with that, all that perspective, what will change with variant strains? In the UK, when the UK variant took off in the London area, they had just come out of a lockdown, 4-week lockdown, and then that variant strain spiked case numbers, and unfortunately, for the first time in the UK, they actually had to close schools as well. That's what they had to do in their setting. It is unknown whether the variant in Canada will become the dominant strain. Some modelers are predicting that maybe it will, especially in the larger urban centers. We'll have to monitor that and take appropriate measures. For us in Saskatchewan, and obviously other provinces are watching that closely as well. Other countries that have reported variants of concern are watching that closely in their settings as well. But, we will constantly have to stay the course with our public health measures, keep seeing a downward trend, monitor the impacts of variants of concern and see if we need to adjust, and most importantly, continue to strive for a high vaccine uptake. As soon as vaccines come, they go into arms, because that still remains a very important measure over the next weeks to months. That will, to some extent, protect us from current strains and variant strains as well. And obviously, are variants of concern more transmissible? Are they more lethal? How effective are current and future vaccines against current and future variants? That all is going to be monitored very closely.
And I would just add to that, and this is leads to the conversation I had this morning with the CEO of Pfizer on the variants and the efficacy of the vaccines, which seems to be very good, and that is good news. And I think also speaks to the importance of us continuing to have access to these vaccines and having access to these vaccines as quickly as possible. Through the discussion this morning, we talked about the UK variant being the predominant variant in the UK, and the fact that they now have about 15% of their not 15% of their population, but about 15% of their doses out as a percentage of their population, and they are starting to see some effects from having that degree of their population vaccinated. Israel as well has been using predominantly the Pfizer vaccine. They're up close to 60% of the doses as per their population out, so we have the opportunity to see that these vaccines or do seem to be quite adept at handling these other variants that are in place, or at least the UK variant.
We'll take our next question on the line. Operator?
We have Caitlin Wilson with Global.
Dr. Shahab, Ottawa has sent roughly 370,000 rapid tests to Saskatchewan, but less than 7,000 have been used. What's the plan when it comes to the remainder? Are there plans to use them more widely, such as workplaces or schools?
Thanks. So, we can bring, I think it's a good idea to bring a full presentation on testing platforms and how they're being deployed. And I'll also ask Scott to maybe add some comments now, but we can certainly bring those numbers forward at a future date. But you're absolutely right that, our mainstay is in-lab PCR testing. That's very successful. And then when required, that same specimen goes for genotyping. But there are, point-of-care PCR tests that are deployed in Saskatchewan. There are point-of-care antigen tests that are being deployed in Saskatchewan. They give results within minutes to hours. They are being used in long-term care facilities where it's really essential to keep screening staff and residents where appropriate. They're being used in outbreak settings. Saskatchewan, we must say, was one of the first provinces to deploy Gene Expert as way back as I think April, May last year when we had an outbreak in the Northwest. So we have done really well with deploying point of care and mobile testing facilities throughout the province. But, we can certainly bring a more comprehensive summary of which platforms are being deployed, how they're being used. And I'll just maybe ask Scott if he has any comments, or maybe we can bring more information at a later date.
So first of all, I agree with Dr. Shahab that I think it would be worthwhile to bring a broader overview of the testing strategy, but I just would like to highlight that in particular with the antigen testing, we are working hard with the testing team to implement the PanBio antigen test across long-term care facilities to help screen and identify outbreaks before they come. And we've got 75 facilities that have been targeted for doing the test. 23 have already begun, and 22 right now are in training. We are also using that same test modality, the antigen testing, to expand to work with correctional facilities. And although we haven't worked through what the future holds with respect to schools or businesses, there certainly is an opportunity for us to use this type of test to do some more surveillance. But I think, again, we should have the lab experts, as Dr. Shahab weighed in, talk about where the best place is to utilize these tests to get the most bang for your buck. But certainly we are working hard to deploy the tests we've received, but we're doing that in a targeted way, focusing on long-term care. And as I said, we were just moving into the correctional facilities to start.
Do you have a follow-up, Caitlin?
No.
We'll take our next question in the room. Adam?
Premier, you said the way out of the pandemic is through the vaccine, but we could do what other places in the world are doing, and even in the Maritimes where they got down to very little cases and then restrictions are eased and people can live life more normally. So you could take that path. We're not doing that. Why not?
We're not doing it because, one, the measures that we have put in place have been effective in lowering the numbers that we have. The numbers in Saskatchewan have been somewhat challenging as of late, but the measures that we have had in place now since early December have been increasing throughout the fall and have proved to be effective. And I spoke at the outset about the impacts of COVID-19, and not just the impacts directly of the virus, but the other impacts that families are feeling, not just in Saskatchewan, but also in the Atlantic provinces and other areas of the world that are at varying levels of lockdown, I would say. And Saskatchewan has charted a path where we have made every attempt to keep our small retail business open to a 50% capacity, larger retail to 25%, for example, to ensure that we are protecting not only lives, but livelihoods. And I would go back to the outset of COVID-19 when we began this conversation some 10, 11 months ago. The focus was understanding that this is a virus that is going to impact our communities, and we are going to do everything we can to preserve our way of life and to preserve our healthcare system here in the province. And I think under Dr. Shahab's advice, we have been able to do just that, to protect lives and to protect livelihoods across the province. Do we want COVID to be a conversation of the past? For sure. For certain we do. And our way through that is with access, broad-based access to the masses in this province and this nation of vaccines. And we're working very closely with other provinces and our federal government to ensure that we can not only procure those vaccines, and enough of them, but to receive delivery of them as soon as we possibly can. That's why I was talking to the CEO of Pfizer this morning. That's why I talk to my colleagues across the nation almost on a daily basis.
Follow-up?
If we continue on this, 200 plus cases average over the next little while, more people are going to die based on what we've seen in the last month or so. So is the status quo good enough to prevent more people from dying? I know you showed the chart there and it's ranging in age from 20 all the way up to 80 plus. Can we maintain this with our current measures? Or will we see this drop more significantly doing what we are continuing to do? Are we going to see a steady drop, or are we going to see us continue to go on the same path?
So maybe I'll just take a step back also and say that, we obviously monitor the measures in place and the impact of that at national, provincial level, globally as well. So we have a public health measures team that looks at that. So obviously, Australia and New Zealand have done very well by restricting travel in the first instance. So if you want to go to Australia now, you have to book a hotel space, and you can't really go even as an Australian citizen till April, till you've booked a hotel space. And so different countries have done different things, and they also, it depends on what your neighborhood is. In Canada, we're north of North America, so obviously lots of trade, essential trade, and other things that happen. And then within Canada, there's the Atlantic bubble, there's the Western Canada, prairie provinces. In many cases, right from the beginning, we've known that it's a very integrated economy. Many people cross the border for essential work. So that is the reality, and so in Western Canada, our fortunes rise and fall together to some extent. And obviously, sometimes, we have been higher than other provinces, which we are currently at other points. Other provinces have been higher, and so we've all adjusted our measures, locally, provincially, and what they mean for interprovincial. And so, and then we have the example of, similar countries, like the UK and Western Europe, which we have monitored closely. So it is a challenge to how low do you keep your numbers, how long can you sustain that, and obviously the impact of that on, reducing case numbers overall, hospitalization and deaths, and also other outcomes, intended or unintended, on economy, on mental health, and society. And even with best intentions in many parts of the world, after lockdowns, cases will also go up sometimes. Sometimes with moderate measures, cases come under control. At the end of the day, it does translate to government measures, but also individual adherence to those measures at an individual and community level. So based on that, it is a concern that we are still averaging around 200, 225 cases We're certainly trending down, but not as fast as certainly we would like to see. We're constantly reviewing what are specific areas that we can reduce, and really can't find one specific area. Obviously, I mentioned that in some settings like bars, if people aren't complying with guidelines, that does increase transmission, like has happened in Saskatoon. That absolutely shouldn't happen. We've also seen that whereas there's other gatherings where currently, for example, places of worship, you can only get together up to 30, but even there, if you don't preserve physical distancing, mask use, we have seen transmission and death. So again, I think, the ability to allow some things to continue, but then making sure that all of us, follow the guidelines to a T, I think is going to be essential for the time being. But this is something that we have to constantly monitor. What are the sectors in which transmission is happening, and then how to further support individuals, those settings, whether they're businesses or other settings, to minimize transmission rates. Occupational health and services reaching out to all workplaces to make sure they update their COVID guidelines and make sure that transmission in all, not just your place of work, but during breaks, is minimized. But this needs constant attention. And I'll just make one comment that, we obviously, if people are unable to isolate at home, they should have that discussion with public health as cases or contacts, because in some cases, there can be some other arrangements to be made to isolate safely at home, because again, every case generates 1 to 2 additional cases, mostly in the household setting. Our overall number of contacts are low. And so if you are 3 people in a house with 5 rooms and 3 bedrooms, it's easier to isolate. It doesn't guarantee there'll be no transmission, but there is sometimes transmission. If you are living in more crowded situations, it may be harder for a case to isolate. So then it's important to have that discussion with public health to look at other options for cases to safely isolate for the 10 days that they need to, and for contacts to safely quarantine for the 14 days.
We'll take our final question on the line. Operator?
We have Janelle Blakely with CTV.
Hi there. Thanks for taking my question. 5 deaths have been removed from the province's counts over the last couple of weeks because it was determined they were not COVID-19 related, though they had tested positive. From what I've been told by the SHA and Health, was deaths were all from extended care Parkside. I'm just wondering, what's the confirmation and reporting process for a COVID-19 death when there's a third party, such as extended care, involved?
So maybe I'll make some initial comments, and then Scott can add. From the public health side, obviously all cases are followed up actively and their contacts. And if there's a death, unfortunately, there is a confirmation that happens with the care providers, including physicians, that was the death due to COVID or was COVID an incidental finding. So you may have a situation when there's an outbreak and someone may be COVID positive but actually asymptomatic, but a death may have been due to pre-existing conditions, or someone was doing poorly in a situation where other factors were involved. So that detailed discussion does happen before a cause of death is ascribed. And in some cases, that has to be revised, where death was ascribed to COVID, on further investigation was not, or vice versa, it was not ascribed to COVID. So there's always that adjustment that always happens, and I'll maybe see if Scott has any further comments.
Well, the only thing that I would add to what Dr. Shahab has already said with respect to the investigation around a death is that it doesn't matter if it's in an extended care facility or a SHA long-term care facility or an SHA acute care facility. The processes are not different.
Do you have a follow-up, Janelle?
No, I don't.
That concludes today's update. Thank you for joining us.